So in this video we are going to discuss about hypertension, and hypertension simply means elevated blood pressure. So that's the simple definition of hypertension. So what you will ask yourself is what is the normal range, so that you can say it's elevated blood pressure. So let's go. So here is a staging of high blood pressure. As you can see, there is normal blood pressure, which is around systolic blood pressure is less than 120 millimeters of mercury, while the diastolic is around is less than 80 millimeters of mercury. uh, After that, we have what we call elevated or pre-hypertension, and it's around systolic pressure is around 120 to 129, while the diastolic is around 80 to 89. Then when a patient presents with pressure of systolic of 130 to 130, that is what we call stage 1, and having also uh, systolic or diastolic of 80 to 89. Stage 2 is when pressure is above 140 millimeters of mercury, and then diastolic is above 90 millimeters of mercury. So what you need to take a note is about what we call white coat hypertension. A white coat hypertension is when you have a patient who presents with raised blood pressure when he or she is in the office, and when he or she is out of the office, the pressure is normal or below normal. This is actually not hypertension, but we call white coat hypertension. And the research says that this is caused majorly by stress around or within the job place. So to rule out white coat hypertension, you just need to take an average pressure of a patient or a person when he or she is in the office, and average pressure of that person when he or she is at home. So you will see the different range, and when you can see that the patient has a normal blood pressure when he or she has a normal pressure when he or she is at home or at outside the job place, you can say that this patient is not hypertensive, but he has what we call white coat hypertension caused by stress at office. So maybe someone when someone enter the office, he has a lot of job pressure, anxieties are there, so there is a rise in blood pressure. So another thing we ask ourselves is what is the cause of hypertension. So let's move to the causes of hypertension. So causes of hypertension are majorly classified to primary and secondary hypertension. So primary hypertension is when we don't know when there is no underlying cause of that hypertension. Well, the secondary has an underlying cause like diseases in the body. So let's go directly to discuss the primary causes of hypertension, and one is when somebody has what we call hypersensitive nervous system. Hypersensitive nervous system, as in those people who are smoking, those people who are alcoholic, those who are diabetic, those people who are obese, those people who use nicotine. They cause those substance goes what we call hypersensitivity in nervous system. And how does hypersensitivity in nervous system cause hypertension? That's the next question you will ask yourself. So when a patient have a hypersensitive nervous system, it stimulates the sympathetic nervous activity. So we have different ways in which the hypersensitive nervous system stimulate pressure. One is increase in sympathetic nervous activity. When there is increase in sympathetic nervous activity, it increases the activity of epinephrine and norepinephrine on smooth muscle. As you understand, the activity of epinephrine and norepinephrine, it has a sympathomimetic effect on the nervous system. So when it enters the nervous system, it actually causes vasoconstriction. And when there is a vasoconstriction, there is increase in tonic peripheral resistance. And when there is a tonic peripheral resistance, it will increase blood pressure. So this is one way in which sympathetic hypersensitive nervous system increase pressure. And we can say those smoke that contain those smoking agents that contain nicotine, or that has nicotine, it has this effect because they are adrenergic, because it stimulates the adrenaline, and adrenaline has this effect on smooth muscles, and also on tonic peripheral resistance. So that's one way. The second way is the effect of epinephrine and norepinephrine in the kidney. So the effect of norepinephrine or epinephrine in the kidneys specifically affect the juxtaglomerular apparatus. The juxtaglomerular apparatus is a site that regulates the blood pressure of a person in the body. So when there is an increase in epinephrine and norepinephrine, it stimulates the juxtaglomerular apparatus to stimulate the production of renin enzyme. And renin enzyme stimulate production of angiotensin 2 in the kidney. And angiotensin 2 causes vasoconstriction. When it causes vasoconstriction, it causes increase in tonic peripheral resistance, and the end result will be elevated blood pressure. So it's simple as that. The effect of epinephrine and epinephrine in the kidney, it affects the juxtaglomerular apparatus. Juxtaglomerular apparatus is informed that there is a need to increase production of renin enzyme, increase the activity of production of angiotensin 2. Angiotensin 2 tend to cause vasoconstriction, and the end result of vasoconstriction is increase in tonic peripheral resistance, and the end result actually is elevated blood pressure. So another way is epinephrine and norepinephrine can act directly on the SA node of the heart, and when it acts directly on the SA node of the heart, it causes increase in the impulses, causing vasoconstriction in the heart muscles or the smooth muscles, and end result is increased blood pressure. And also it can act directly on smooth muscles. That way is it causes sodium decrease in sodium excretion. When there is a sodium decrease in sodium excretion, it means there is high sodium retention. And when there is a high sodium retention, it means sodium is has a sympathetic sympathomimetic effect, which means it causes a rise in blood pressure. And when there is a rise in blood pressure, it will inhibit production of renin, because one um, one stimulant of production of renin is low blood pressure. So when there is high sodium, low sodium excretion but high sodium retention, PP will be rising, because as you understand, sodium is a positive charge which causes muscle constriction, and also it causes vasoconstriction. So what does this statement means? That when PP is rise, it inhibits the work of renin, angiotensin, aldosterone system. There will be low production of renin, and also there will be low production of sodium. And what does this effect? When there is low production of renin, it means there will be low production of angiotensin 2. And when there is low production of angiotensin 2, there is relaxation of smooth muscle, because angiotensin 2 is a muscle, smooth muscle contractor. So it will decrease the tonic peripheral resistance, and finally decrease in PP, and this is why it is called low renin production. So this effect actually goes like that, and this is why we call kidney is a major blood regulator. So they can note that when there is an increase in sodium retention and decrease in sodium excretion, there is a rise in BP, and when there is a rise in BP, it inhibits the renin-angiotensin system, what we call rush, and then it causes low production of renin and low production of sodium. And when there is low production of renin, there is low production of angiotensin 2, and then when there is low production of angiotensin 2, there is relaxation of smooth muscles, and when there is a low relaxation of smooth muscle, there is decrease in tonic peripheral resistance, and when there is decrease in tonic peripheral resistance, the end result is uh, decrease in blood pressure. That is a way in which there is hypersensitive nervous system, and you should remember to talk about norepinephrine and epinephrine, because this is the master, the engine of or a propelling factor. It's a propelling factor to hypertension. So that's one way in which hypertension is caused by hypersensitivity, and it's common in people who are smoking. When those people who are smoking, um, alcoholic patient, diabetic patient, because of hyperinsulinemia, we have obese because of vasoconstriction. So all these effect causes a rise in blood pressure. So let's proceed. uh, Secondary causes of hypertension. Let's think of secondary causes of hypertension. The secondary causes of hypertension means there is underlying condition. There is an underlying condition that leads to blood pressure. We ask ourselves, what are these underlying conditions that can lead to hypertension? One is when there is a disease in kidney, when there is a disease in thyroid, when there is a disease in endocrine. Let's see how does these problems affect kidney problems. Take for example, when there is a problem in renal axial tissue. Renal axial tissue majorly means the glomerular of the kidney. So when there is a problem on the glomerular, like for example, glomerulonephritis, diabetic nephritis, which is the common cause of EKD is diabetic nephropathy. So when there is a problem with this when there is a problem with kidney, it means there is no filtration of electrolytes which should be filtered properly, and these electrolytes we mean sodium majorly. So it means there is high retention of sodium, and when there is high retention of sodium, it will circulate in your system, and when there is a high circulation of sodium in your system, it means there will be a rise in blood pressure. So that's one way in which when a patient have a problem in a renal axial tissue. The renal axial tissue means the actual part of the kidney. So that's one way, and majorly we'll talk of the actual part, that's the glomerular. Secondly is when there is a problem in the vascular, as in renovascular. The when we say the vascular is the blood that supplies flood to the kidney, let's say a vein and a vein blood vessel. So when there is a problem there, it means this it means actually there will be rise. Why? For example, when there is a renal stenosis, we have vasculitis, we have dysplasia. When there is when you have dysplasia, when you have dysplasia, when you have renal we have said renal stenosis, vasculitis, muscular dysplasia. All these will cause sodium retention, because there will be no good blood supply or blood flow to and from the kidney. So let's go to endocrine causes. When there is let's talk about aldosterone as in a patient with Cone syndrome. Patient that has Cone syndrome causes rise in aldosterone. When there is a rise in aldosterone, there is rise in sodium, and when there is in sodium, there is sodium retention. I mean, when there is sodium retention and water retention, it means PP will be rise. Increase in another way is increase in cortisol level, as in Cushing syndrome. A patient who has a Cushing syndrome will come with high levels of cortisol, and when there is increase in cortisol, it increases the sensitivity of epinephrine and norepinephrine at specific receptors, and it will cause a propelling effect, which causes vasoconstriction, and the end result is increase in blood pressure. So actually that is another way in which cortisol and aldosterone cause blood pressure. So another way is the effect of epinephrine and norepinephrine, as in pheochromocytoma. A patient who has a pheochromocytoma will have increase in epinephrine and norepinephrine. And earlier we have seen the effect of epinephrine and norepinephrine as a vasoconstrictor, and it also causes increase in heart rate and also causes increase in stroke volume, and in many ways it will cause a rise in high blood pressure. So what you need to remember is a patient who has Cushing syndrome will have increase in aldosterone. A patient who has increase in levels of aldosterone will have increased sodium retention and water retention, and the end result of this is increase in blood pressure. Remember cortisol in Cushing syndrome, the patient has epinephrine and norepinephrine increase, sensitivity at specific receptors, which cause a propelling effect causing vasoconstriction, and the end result is increase in blood pressure. Another one is increase in epinephrine and norepinephrine in pheochromocytoma, which causes increase in heart rate, vasoconstriction, stroke volume, all those, and the end result is to cause increase in blood pressure. When a patient has a thyroid problem, as in hyperthyroidism, a patient who has hyperthyroidism will have increase in T3 and T4. And when there is an increase in T4, there is increase in heart rate activity, increase in epinephrine, norepinephrine, sensitivity at specific receptor, and the end result is increase in blood pressure. So the actual effect of T3 and T4 is a vasoconstrictor, and also it has an effect on increase in epinephrine and norepinephrine. Hypothyroidism. In hypothyroidism, there is decrease in T3 and T4 production, which in many ways it will have an impact in the kidney. When there is a decrease in production of T3, T4, there is many ways in which it affects the kidney, and when it affects the kidney, it will cause sodium retention, and when it causes the sodium retention, it will have an impact in blood pressure. And in sodium retention, it will sodium retention causes vasoconstriction, and then it causes increase in tonic peripheral blood pressure, and when there is tonic increase in tonic peripheral blood pressure, the pressure rises. Another way is hyperparathyroidism. A patient who has hyperparathyroidism, there is increase in hyperparathyroid hormones. So when there is an increase in hyperparathyroid hormones, that patient will have increase in calcium level, and when there is increase in calcium level, calcium is a vasoconstrictor, and the end result is increase in blood pressure. So you must remember the kidney, those patients who have glomerulonephritis, those patients who has diabetic nephritis, and those patients who has glomerulonephritis or any type of glomerulonephritis, they may present with moon face, bumpiness of the face. Those patients as those are symptoms. So actually you should remember that those are symptoms. So less all a patient who has Cushing syndrome also may present with moon face or puppy face also. So we can proceed. So other causes include coarctation of aorta. So what do we mean by coarctation of aorta is just narrowing of part of the aorta. And when there is a narrowing part of aorta, it's like tying a pipe at a point and pumping water. It will force the heart to pump water but in the process of pumping water, it increases the tonic peripheral resistance, and increase in tonic peripheral resistance, it means there is increase in blood pressure. Another way is increase intracranial pressure, ICP, like in patient with head injury, I mean. So patient with increase in intracranial pressure will present with Cushing triage, that is low respiratory rate, low heart rate, but increase in hypertension. So what we just mean with Cushing triage is there is increase in heart rate, there is decrease in there is increase in hypertension, sorry, there is decrease in heart rate, and there is increase in pulse. So that is what we mean by Cushing triage. How does this happen? When there is increase in intracranial pressure, it means the blood flow to the brain is lowered, and also perfusion to the cerebral part of the brain is low, and in the process the arterial blood flow is increased, because the pressure up there pushes blood not to pump blood to the part of the brain, decreasing perfusion of the brain, and also the flow of blood to the brain. So the end pressure being needed to be forced to the up there will be end up being forced to use on the arterial part, so it will increase the arterial blood flow on the other side. So that's another way blood pressure is increased, and those patients will present with vomiting, they will present with headache, and the type of vomiting they come with is projectile vomiting actually. So another one is drugs, and we can talk of oral contraceptive or combined oral contraceptive product. Actually, this is simple because all oral contraceptive products cause increase production of angiotensinogen in the liver, and when there is increase in angiotensinogen, you actually know it's increase the angiotensin 2 production, and when there is increase in angiotensin production, the end result is in angiotensin 2 is a vasoconstrictor, and when there is a vasoconstriction, there is increase in tonic peripheral blood pressure, and when there is increase in tonic peripheral blood pressure, it means blood pressure will actually go higher, and that's another way in which oral contraceptive products causes blood pressure. We have sympathomimetic drugs. Example is cocaine, benign glycine, we have lactic acid. So as you understand, sympathomimetic drugs, from the word mimetic, it means it mimics the activity of sympathetic system. So it activates the vasoconstrictors in another way. So those drugs causes a rise in blood pressure. For example, someone uses cocaine. Another one is monoamine oxidase inhibitor. Monoamine oxidase inhibitors are drugs used for certain depressant. There are certain antidepressants, and when used with diramine products, for example, cheese product that have diramine, and also when used with products that have diramine can include cheese product that have diramine. Another one is cured meat. So side patient who uses monoamide oxidase inhibitor should not use diramine should not use diramine product. Why? Is because this diramine product used with M M MOs MAOs or monoamine oxidase inhibitors, it causes sympathomimetic effect. It has a strong symptomatic effect, and it is the most cause of hypertensive crisis. So it's not good for a patient who uses monoamide oxidase inhibitors to hit sausage. As you understand, sausage has diramine components, to hit cured meat, to hit cheese product. So when you just combine with a monoamine oxidase product, expect to have what we call hypertensive crisis. Another drug we can talk is serotonin syndrome. in patients using certain antidepressant. In serotonin syndrome, there is increase in neuromuscular hyperexcitability, which is uncontrollable. So what does neuromuscular hypersensitive is certain activity in the brain that causes excitement in the brain, and when there is excitement in the brain, it has an impact in cardiovascular system, and when it leads to increase in activity in the cardiovascular system, and when there is increase in cardiovascular system, it will mean pressure will be elevated, and those people who uses fluoxetine, paroxetine, escitalopram, so expect to have this effect, to us this effect to have this effect. So you expect to have this effect. So let's proceed. So let's move and see what we call hypertensive crisis. Hypertensive crisis is a rise of blood pressure of 100 systolic over 120 diastolic, and we have two types of hypertensive crisis. One type is hypertensive urgency and hypertensive emergency. What urgency means there is increase in blood pressure above 180 over above 120 with no organ damage, while emergency is above 180 and 120 with organ damage. So actually it's simple like that. The other one does not have organ damage, while the other one have organ damage. So the main point where this hypertensive crisis present is the high. A patient who has hypertensive crisis will present with blood vision, exudating the eyes, with dark images. So those are the things you will have in dilated pupils. So those are the things you will have in a patient with hypertensive crisis. And then the effect of this hypertensive crisis is really serious. So a person who has hypertensive crisis, it means the left ventricle of the heart will be mostly affected, and mostly those people with hypertensive crisis present or may have what we call left ventricular hypertrophy. So why the left ventricular hypertrophy is because the blood coming to heart is the blood volume in the heart increase, and which means the heart activity to pump blood will increase, and in that results the heart will pump they'll get tired, and when the heart get tired it hypertrophies because it becomes weaker. And that is why we call left ventricular hypertrophy. As you understand, it's the left ventricle that pump blood to the resting part of the body. So when the activity is increased, it means it will cause hypertrophy. Another one is left brain block, LBBB, left bundle brain block. What means is a disturbance of electrical imbalance in the heart because of a high amount of blood in the body. So when this happen, there is disturbance in impulses, and the end result is that the heart will not have a good electrical impulse and may fail. Another one is diastolic heart failure, also called heart failure with blood ejection. So in diastolic heart failure, it happens when the left ventricle which pump blood becomes stiff and unable to pump properly. So when the heart is unable to pump properly, it will have what we call the left heart failure, and the result can be death. Another one is ischemic heart disease, because the heart is unable to pump blood and it has hypertrophied, died to die. So the result is heart ischemic. Another one is arrhythmias. Another one is aortic dissection. So due to the effect of high blood pressure in aorta, it can dissect some part of blood pressure, because the blood will be hitting some part of aorta, and it can dissect. Another one is abdominal aortic aneurysm. It can cause a bursting of aorta in the blood vessel in the abdomen, and it can be a serious problem. That is what we call AAA. Another one is arteriosclerotic plaque because of damage in the endothelial system, because as you know, blood will be moving in high blood pressure. It means that the endothelium system, or the inside part of blood vessel will be damaged, and when it is damaged, it can cause a pus or a plaque. So it will cause something like a clot, and that is what we call arteriosclerotic plaque. Another one is a hyaline arteriosclerosis in the kidney due to damage, in the kidney by high blood pressure. It will cause what we call hyaline arteriosclerosis, and hyaline arteriosclerosis can finally lead to chronic kidney disease, or CKD. So there's different organs affected by hypertensive crisis, or high blood pressure. Let's look in brain. In brain, we'll go deal with look at three major effects. We have what we call lacunar impact. We have what we call Jacot Bouchard aneurysm, and what we call subarachnoid hemorrhage. So what does lacunar impact means? Lacunar impact means it's occlusion of a single penetrating branch of a large. It means a large cerebral artery in the brain is being occluded. So when there is occlusion, that's what we call lacunar impact. While the Charcot Bouchard means aneurysm in bulges in tiny arteries. The other one is large cerebral artery, while the other one is tiny cerebral artery. So it's symbol like that. Lacunar impact is on large cerebral artery, while the Charcot Bouchard means it's in a tiny artery in the brain. So that's a symbol like that. What about a subarachnoid means when the blood vessel has burst, and then the blood leaches to the two membrane of the brain. Let's say the we have any tissue or any membrane in the blood. When blood leaches into the any membrane in the blood, we call that is subarachnoid hemorrhage, and it is due to the bursting of aneurysm. So remember, lacuna is in large artery, while the Jacot Bouchard means it's in the tiny artery like that. So I think that is all we can say about hypertensive crisis, and I think we should actually remember that hypertension or lifestyle, you can see, contributes major to hypersensitivity of nerves in the body, leading to hypertension. So I think let's try to moderate our lifestyle, and then we just know how we live, so that we can try to manage hypertension actually.